Continuing on with sinus rhythms, we're going to discuss sinus arrhythmia. Sinus arrhythmia may also be known as sinus dysrhythmia in some textbooks. So, our objectives for this module: differentiate between the normal variation and the regularity of normal sinus rhythm versus the presence of a sinus arrhythmia, and accurately identify sinus arrhythmia on a rhythm strip. So a sinus arrhythmia is a variant of normal sinus rhythm, except it's going to not be in a regular interval. There's a variable interval of 0.16 seconds or more in between each of the sinus complexes. In some patients, there may be a slight irregularity in between each of the sinus complexes. However, this irregularity should never be by an interval of greater than 0.16 seconds. And when it is, then we will consider this a sinus arrhythmia. Sinus arrhythmia originates in the SA node. The P waves and the PR intervals are consistent, but the P to P intervals can vary greater than 0.16 seconds on a strip. So you're going to have a difference in the rhythm here. So the big issue that we will see with the sinus arrhythmias is not rate, but it's going to be the regularity of it. So there's two types of sinus arrhythmia. You've got respiratory or phasic sinus arrhythmia and non-respiratory or non-phasic sinus arrhythmia. So the effects of inspiration on the heart rate includes an increased amount of blood that comes into the thoracic cavity during inspiration, which causes the right ventricle to fill more efficiently and pump more blood. The vascular system in the lungs is very large and can accommodate the extra right-sided cardiac output. But since the vascular system's under low pressure, blood has a tendency to stay in that area. Vascular pooling decreases the amount of blood returned to the left side of the heart. Decreased left ventricular output causes a temporary drop in blood pressure. And a transient drop in blood pressure triggers a vagal response momentarily that increases the heart rate and vascular tone in an attempt to equalize the drop in blood pressure. So during expiration, more blood is allowed to enter the left side of the heart. This causes an increase in cardiac output. As a reflex, the heart slows down. So this actually is what will cause the presence of a respiratory sinus arrhythmia. More evident when the underlying heart rate is bradycardic. Athletes typically have a slower than normal heart rate, and it's common in young children, but it also disappears as they get older. Respiratory sinus arrhythmia is a variant of normal and is not a pathologic arrhythmia. So this is an example of respiratory sinus arrhythmia. So if you notice how you are irregular and then you're regular on inspiration, and then expiration you have changes in your R to R or your P to P. Non-respiratory sinus arrhythmia is not associated with the respiratory cycle or any other physiologic event, but it's not a variant of normal. So oftentimes, if they've got a cardiac issue, underlying cardiac issue, it could cause a sinus arrhythmia. So looking at the rules here, what's the rate? It's 60 to 100 beats per minute. The rhythm is irregular, so this is where it's going to break the rule. The P wave should be before each QRS. P wave should be upright and uniform. And the length of the PR interval should be 0.12 to 0.20 seconds. And then all the QRS complexes should look the same, and they should all be less than 0.12 seconds. So again, here's just another way to look at it. The rate is usually between 60 and 100. It can be fast or slow. It's regularly irregular. The P waves are present in sinus and origin. Same morphology throughout. Upright in leads 2, 3, and AVF. The P-QRS ratio is a 1-to-1, which means you got a P wave for every QRS, QRS for every P wave. Your PR interval should be normal and consistent across the board. Your QRS width should be normal. It possibly could be wide, but you're usually going to see a normal. You have no grouping and no dropped beats. So looking at an example here, So it is a 6-second strip. Rate 1, 2, 3, 4, 5, 6, 7, 8, 90. Rhythm, well, you can look at it and tell, but the best thing to do is follow your rules and use some calipers, and you'll determine that it is irregular. The P wave, sinus and origin, you can tell. The PRI looks to be about 0.16, and the QRS looks to be about 0.10 seconds. So it follows the rate rule, it follows the P wave, the PR, and the QRS, but the rhythm is irregular, so that makes this a sinus dysrhythmia. Take a look at this one. So the first thing that I'm going to notice, because I'm going to go through my rules, is that I've got more than a 6-second strip right here. So I want to make sure that I am only counting the complexes within the 6-second strip. So my rate is 60. So if I look at my regularity, I'm going to see that it's already irregular between these two R to R's. So it is irregular. My P waves are good. They're sinus P waves. My PRI looks to be around 0.18 or so. My QRS length, even though, again, this is ST elevation, my QRS, I would measure it to right there. So it's going to be about 0.08 or so. So my rate is fine. My regularity is not. It's irregular. My P wave is good. My PRI is good. And my QRS is good. So we've got sinus arrhythmia here. Same thing as far as your 6-second strip goes. Make sure you've only got 6 seconds. 1, 2, 3, 4, 5, 6, 70 is my rate. My regularity, so I can tell that there's a difference in the R to R's, so it's irregular. P waves look good. PRI is 0.16 or so, and QRS is about 0.10. So again, everything checks out except the regularity, and this is going to be a sinus arrhythmia. Same thing here, not to be confused with an atrial fibrillation because of the way that the baseline kind of looks a little weird, but you do have definitive P waves right here and right here and right here. So it is irregular. Rate is 60. PRIs look consistent. QRS looks consistent. So again, you've got a sinus arrhythmia. So typically, sinus dysrhythmias, they're not going to be required for you to treat. Usually not a cardiac emergency, and it usually doesn't require cardiac treatment. Usually it'll just be something that we notice on the monitor.